Hello everyone, I'm Dr. David Ajibade and I'm going to be talking about in the next series of videos sickle cell disease in Nigeria, what it's all about, the complications, what you need to know if you're a parent, a guardian, a sickle cell disease survivor, warrior, whatever the term you may choose to use. It's basically to give you like a 360-degree view on the problem. Now, as I look at it, I think through it, and I was shocked to find out that Nigeria is number one in the world when it comes to sickle cell disease. And that's not too shocking when you think about it. It's primarily a black problem. Now, India too is really big. There are lots of children with sickle cell disease and adults with sickle cell disease in India. And I think Congo is number 2 or number 3 in the world. But Nigeria is number 1. And the statistics are shocking. Before, only 50% of all sufferers or patients actually reach their 10th birthday. Some even say it's less than that. And there are so many issues that surround this condition. It's not just about having crisis. And as we know, a lot of our treatment is about trying to help the child get out of crisis or to prevent a crisis. But it's more than that. These children enjoy a quality of life that is less than their average and their peers. And so we want to look into it, look at it from every possible angle, 360-degree angles, and say, well, what can we do? What do parents need to know? What do the patients need to know to be able to live a long, healthy life, as normal a life as is possible? And as you know, knowledge is power. The more you understand the condition, the more you're able to see the condition from the different angles, the more likely you are able to take control of your health. So don't miss any of these presentations. They're going to be short presentations that you can just grab the nuggets, the essential tidbits that you need to know and that you need to have in order to take control of your health. I have to emphasize that this is not a replacement. None of the things we'll be talking about will be a replacement for your doctor's care and attention. You still have to go to the hospital. You still have to see the doctor. These are things like drinking water, for instance, and how much water you need to drink on a daily basis that you need to know and do. Especially, then we also talk about the kind of foods that you should eat, foods to avoid. We talk about emotional stress and how that can trigger a sickle cell crisis. We also talk about the immune system. There's a whole gamut of things. We're also going to be talking about complications and what you can do to avoid the complications, and even if you have them, to be able to recover from them. So it's going to be action-packed. It's going to be rich. Don't miss any of them. See you soon.